so I'm just going to inspect your back right here. And it looks that your back does not have any moisture. It's a pink color, and your ribs slope down. Your AP to transverse is a 1:2 ratio, and I'm not feeling any masses or anything. Okay. And it doesn't seem like you are requiring any extra effort to breathe. All right. So now I'm going to just observe like your breathing. So I'm going to have you take a deep breath in and out for me. Okay, perfect. Okay, so now I'm just going to listen to some of your lung sounds. And whenever you feel this touch your skin, I'm going to have you take a deep breath in and out through your mouth.
Okay.
If you don't mind, it's gonna. Okay. Okay. Okay, perfect. I took 20 of your respirations, and your lung sounds are clear in all lobes.
Okay.
And I think I'm gonna get started. I'm gonna feel your skull first. So, just get up in here. Okay. So her skull is proportionate to her body. It is round. It is normocephalic. And I don't feel any like protrusions or depressions or anything like that. Okay, so I'm gonna feel your temporal pulses. Oh, cool. Okay, and I would rate them a 2 from a 0 to 3 scale, and they are symmetrical. Okay, so I'm gonna have you open and close your mouth. Okay, so both sides were symmetrical, and there was like a smooth movement of her face. Okay. Now I am going to have you smile. Okay, so her face is symmetrical. There's no twitches. There is no edema. There's no edema. There's no involuntary movements, and the only lesions on her face are some freckles, a few moles. Okay. So now I'm going to inspect your neck, and I'm just going to have you do a few movements for me, but I'm just going to come back here first. Okay, so her neck is pink, it's symmetrical, there's no moisture or anything, and it's looking great. And I'm going to have you put your chin to your chest, and then look up at the sky, and then look at me, and put your left ear to your left shoulder, and then right ear to your right shoulder. Okay, perfect. Okay, so she has no, Did you have any tenderness with that?
Mm-mm.
Okay, her head position is midline, and it was all symmetrical. Okay, so now I'm just gonna check out some of your lymph nodes and just like feel around for them if that's okay. Okay. So I'm gonna start with your pre-auricular. Okay, now your post-auricular. Ow, I don't know how to say that. Now your occipital. Okay, now your submental. Now your I don't know if they can like see. Submandibular. Okay, now your clavicular something. I don't know. Your deep cervical chain and your superficial cervical chain. And now your supraclavicular. Okay, and I did not feel any lymph nodes, but if I did, then I would be testing to see if they were less than 1 centimeter in diaphragm, if they were movable or non-movable, if they were soft or hard, and if they were clustered together or spread out. And if they were, I would ask her if they were tender. Okay. Arteries. Carotid arteries. Okay. Okay, so both of these pulses are symmetrical, and I would grade them a 2 on the scale. And so now I'm going to check for bruise with the bell side. Yeah, the bell side of my stethoscope. Okay, so when I put this on, I'm gonna have you take a deep breath and hold your breath. Okay. Okay, you can breathe. And then take a deep breath. And hold it. Okay, perfect. You can breathe now. All right, awesome. So there are no bruises bilaterally. And now I am going to, find your apical impulse, and it's going to be on your left side, mid-clavicular down 5 intercostal spaces. So, if you don't mind. Okay, perfect. Okay, so now I'm going to osculate just your whole diaphragm with my stethoscope. And I'm going to do that with the diaphragm side, so I'm going to flip it around. Okay, so I'm going to start with your aortic. Okay, now your pulmonic. Now your tricuspid. Sorry. There it is, and now your bicuspid. Okay, awesome. So the rhythm is regular, and there is a presence of S1 and S2 beats, which are the lub and dub, and there are no presence of S3 and S4. And now I'm going to listen to the valve areas of with my bell side, and I'm going to listen for like gallops or murmurs or anything like that. Okay. Okay, aortic, pulmonic, tricuspid. I have a hard time getting this one. Okay. And then bicuspid. Okay. I can hear your stomach a little
I know, I'm hungry.
Okay, cool. So there were no murmurs or...
So now first we're going to check her carotid artery. So I'm going to feel your neck really quick. Okay, so patient's carotid artery is symmetric, and on a scale of 0 to 3, it's a 2, which is normal. And then I'm going to use my bell to auscultate. Okay. Okay, so there were no bruise. And then next we're gonna palpate their apical impulse. Okay, so now I have to. Can I lift their shirt?
Yeah.
Because I have to feel your. It's in the left mid clavicular, right below the nipple line. Okay. Yours is actually really easy to feel, which isn't typical. But then we auscultate the precardium with the diaphragm. Okay. So we're gonna start with oh wait. So this is the aortic. And then the pulmonic. I think I did that wrong. Whatever. And then the tricuspid. And then the mitral. Okay. And then S1 and S2 are present and regular. And then we have to auscultate the valve. The bell. Okay. Okay, so there were no murmurs in S3 and S4, which is good. And then we have to listen to the apical heart rate. Okay, and it was 72. And then, I think that's it. Is there anything I can get you?
I'm okay, thank you.
And then I'd also be checking for consensual reflux. Okay. Can you follow the pen, please? And then here, I'm checking if they accommodate, if they dilate and constrict. Okay. Have you had any changes in any senses like vision, ringing in ears, or smell?
No.
Any headaches?
No.
Okay, and then I would check for JVD and tracheal deviation and her skin turgor. Everything's fine, and then I would pinch her skin to see the skin turgor. How's your balance?
Good.
Okay, so now, I'm going to have you do a few quick faces for me. Can you smile? Can you frown? Can you puff your cheeks? Raise your eyebrows and stick out your tongue straight. Okay, thank you. Now I'm going to be listening to your heart sounds. I'm going to be listening to 5 areas. At the very last area, I'm going to be listening for a full minute to count your beats per minute. So I'll tell you when I get there, because it's gonna be a long time, but I'll let you know. Okay. Do you have any chest pain right now? Have you had chest pain in the past?
No.
Do you take any cardiac meds?
No.
And how is any abnormal heart palpitations?
No.
Okay, perfect. Now I'm just gonna listen to your lung sounds, and then I'll let you know when you need to turn because I'm gonna be listening to your lungs from the back. You're able to turn, right?
Yes.
Okay. Oh, sorry. A deep breath every time I put down my stethoscope. Okay. Any shortness of breath?
No.
Do you smell?
No.
Have you been coughing recently? Any sputum? No. Okay. I'm gonna need you to turn around so I can listen to your lungs from the back. Here, I would check her skin color also, but everything, I can see that she is warm and her skin color is appropriate. See if her coccyx shows any redness or if there's any bed sores, and then I would also check her heels and her elbows. Okay. Fix your sweater. Deep breath. Okay. I can hear that all her lobes are clear and there's no crackles or wheezing. Now I'm going to be checking your incision. Is that okay?
Mm-hmm.
Can you lift your shirt up for me? Okay. So here I'm just going to remove the bandage to see if it's not inflamed, or I would also feel it to see if there's no hotness to it because that would indicate infection. And I can see there's no drainage and everything's fine. The stitches are intact. And I'm going to put it back down. Did that hurt at all?
No.
Okay. So now I'm just going to be listening to your bowel sounds. I'm going to be listening for 5 to 7 bowel sounds for every 15 seconds in each quadrant. Okay. I did hear bowel sounds. When's the last time you had a bowel movement?
Before the surgery.
How is it?
Normal.
Normal. Did you eat anything at all today?
Yes.
What was it?
Just water.
Just water? Okay. So I see you're still on a clear liquid diet, and we'll advance when we notice that you have passed gas. Have you passed gas recently?
Yes.
Okay. And I can tell that her bowels are moving because there were bowel sounds. Now I'm just gonna palpate. Let me know if it hurts or anything. I'll do it in soft circular motions, and I would also look at her face to see if she shows any pain. Does that hurt?
Just a little bit.
Just a little bit? Okay. Move up. And I'll also check for her bladder to see if it's distended as well. And it's not. When's the last time you urinated?
Today.
Today. How was it?
Normal.
What was the color?
Yellow.
Was there any burning sensation or anything unusual? Okay. Any nausea or vomiting?
No.
Okay, we can put your shirt back down. Now I'm just going to be checking for your arms and legs. Have you had any joint pain recently?
No.
How was your walk before the surgery?
Normal.
Normal. Okay. Hold your arms out for me, please. Let me know if you feel any pain, numbness, or tingling. Do you feel both my hands?
Mhm.
They're equal?
Yes.
Okay. Does it hurt when I squeeze?
No.
Okay. Can you squeeze my fingers? Okay. Can you resist? Okay, resist. And I'd also check for her pulses. And then I noticed that her skin is warm and the color is appropriate. And then I also check for the range of motion. The other side. Thank you. And I would also check for cap refill. Lesson 3. Same thing with her legs. Do you feel both my hands equally? Any pain, numbness, or tingling?
No.
Come down to her feet. Then check for cap refill. Lesson 3. And I would also check for her heels to see if there's any sores on it, which there aren't. Can you resist? Push on the gas. Okay, and I also check for her peel pulses. I would check for her cap refill with her socks off. And check for peel pulses. See if they're bounding and equal. Okay. Check for her pulses on her hands too, please. Okay. Make sure they're bounding and equal. Okay. Out here, I lower the bed. Do you have anyone visiting you today?
Yes.
When are they coming? Do you know?
In the afternoon.
In the afternoon. Okay. Do you have a good support system at home?
Yes.
How's your hospital stay been lately?
Good.
Okay. Here, now the bed lowered. Is your bed at a comfortable position?
Yes.
Okay. And I'll be coming back in about 30 minutes to an hour to give you your pain meds so your incision site doesn't hurt that much. So, yeah. Lower the bed, open the curtain, close the door. Thank you.